Clavicle. Clavicle in Latin means a small key. It transmits the weight of the limb to the sternum. It has two ends, the medial and the lateral end, and the curved part is called the shaft. Side determination of the clavicle. The clavicle has a lateral 1/3 which is called the acromial end and a medial 2/3 which is called the sternal end. The clavicle also has the trapezoid ridge, the conoid tubercle and the subclavian groove. The lateral end is flat. The medial end is large and quadrilateral. The shaft of the clavicle is curved, wherein the medial 2/3 is convex and the lateral 1/3 is concave. The inferior surface is grooved longitudinally in the medial 1/3. Features of the clavicle. First, let's see the shaft. The shaft has the medial 2/3 and the lateral 1/3. The medial 2/3 has four surfaces. The anterior, which is convex, the posterior is smooth, the superior is rough, and the inferior is rough. The lateral 1/3 of the shaft has two surfaces, that is the superior and the inferior. The inferior surface also has an elevation called the conoid and a ridge called as the trapezoid ridge. Let's see the ends of the clavicle. The medial end of the clavicle is also called as the sternal end. It is quadrangular in shape and it articulates with the clavicular notch of the manubrium. The lateral end of the clavicle is flattened and it articulates with the acromion process of the scapula. Peculiarities of the clavicle. It is the only long bone that lies horizontally. It is the first bone to ossify. It is the only bone which ossifies in the membrane. It has two primary centers of ossification. There is no medullary cavity. It is occasionally pierced by the middle subclavicular nerve. Attachments of the clavicle. The lateral end is attached to the joint capsule. The medial end is attached to the fibrous capsule, the articular disc, and the interclavicular ligament. Posteriorly, the clavicle is attached to the trapezius on the lateral side, and on the medial side, it is attached to the clavicular head of the sternocleidomastoid muscle. Anteriorly, on the lateral side, it is attached to the deltoid muscle, and on the medial side, it is attached to the pectoralis major. The costoclavicular ligament is attached to the inferior surface, the subclavius muscle to the subclavian groove, and the sternohyoid muscle to the posterior surface. Clinical anatomy of the clavicle. Fracture of the clavicle is commonly seen due to fall on the outstretched hand. The weakest point is the junction between the two curvatures. Cleidocranial dysostosis means congenital absence or imperfectly developed clavicle. In this condition, the shoulders droop and can be approximated anteriorly in front of the chest.